talking with Dr. Stephen Parente from the University of Minnesota.
Mm-hmm.
Dr. Parente, how will precision medicine affect traditional pricing mechanisms?
They will potentially upend them until they kind of settle down. So the problem with precision medicine is that there are a few technologies that price the way traditional pricing would work, meaning by test. But the cures are all over the place, and we're not even quite sure what the pathway is to cure yet for some of these diseases. So that also has to be dealt with on a pretty methodical place, and we don't know what those pathways are. The good news is that insurance companies are used to that sort of complexity, but someone has to guide them through it first before we get there.
You mentioned bone marrow transplants and IVF. What is the analogy between those two earlier technological advances and precision medicine?
Well, initially those technologies were very early on. People didn't quite know how to reimburse them. And so in the case of, say, a bone marrow transplant, there were only a handful of places in the country where that could actually be done. The same thing works for precision medicine. There's only a few shops that really have both the genetic testing capability and then the gene therapy pieces of what's there. And so those early innovators might be in a position to actually determine what the right reimbursement would be that a set of insurance companies or Medicare maybe would be comfortable with over a longer period of time. IVF's a little different. IVF is probably more concerning to an insurance company because the way IVF works is you're paying for rounds and you're not quite sure where the determination will be. So you'll on average know where things will turn out, but it potentially can be very expensive depending upon what you think the success rates are going to be. And if gene therapy works more that way, it might be a slower start to get the reimbursement procedure to go.
You mentioned that there might be a contract with insurers to allow them access to patients' habits through social media and other digital trackers.
Right.
Could you explain that?
Well, it's probably a little bit far off and probably best for millennial patients, but it is true that if you have more information about an individual's behavior, you can better customize a solution for them. So precision medicine is the ultimate end game of that. So it's one thing if you know genetically someone has a predisposition for type 2 diabetes. It's another thing to know that based upon how they're living their life, they're definitely going to get type 2 diabetes and push themselves over the edge. If an insurance company more or less makes a deal from them to say, we need to see your social media information to be able to mitigate that risk more, but in return, we will, in a sense, pay the premium for privacy. We will lower your premium by X% if you let us see all your digital feeds. Then it can make a real difference. So for example, someone might say, I'm committing myself to a healthier lifestyle. If we actually see their GPS phone tracking, if that's allowed, basically low-jacking your body, we could see that they're visiting a lot of different places that aren't necessarily the healthiest eating spots and may not necessarily lend themselves well to a healthy lifestyle area.
And how would medical tourism play out with precision medicine?
Medical tourism could be an early place where precision medicine is paid for on a limited basis. It depends how expensive the precision medicine technologies are. So medical tourism actually combined with health savings accounts, which are growing in popularity, people can potentially either use their own money cash or health savings account money that they've accumulated to potentially go abroad and try out a precision medicine technology, say in an overseas country. Frequently with potentially US or EU trained physician actually doing it, but essentially doing it on vacation for extra dollars. So it sounds kind of maybe not the best and direct path. It could be an entrepreneurial path to try out different technologies and success stories and figure out what might be the best things to come back to the US and be successful.
Thank you.
Sure. Thank you.